Hello class, here is a tutorial on your clinical binder for Nursing 55. Once you open it up, you'll see these several tabs here. Non-tab documents, here we go. Clinical cheat sheets that I've included in there. This gives you another reference on what to look for when it comes to hints on how to finish Nursing 55 successfully. Your whole syllabus in here, I strongly recommend that you read that. Gives you kind of the rules of engagement again for Nursing 55, what assignments to finish and whatnot there. And that's the goal of this video as well. So let's go back to our tabs. In tab 1, we have several forms that are going to be very important for your FISDAP uploads. A binder acceptance form. This is something that you and your preceptor need to read together and then sign. This is also going to be uploaded to your shift number 1 on your FISDAP account. You're also going to read together and then have your preceptor sign this letter to the preceptor. Gives some tips and tricks for your preceptor, all the stuff that you're going to need to upload to finish successfully for Nursing 55, and some essentially some rules on how the preceptor can treat your clinical experience, what you are allowed to do. This is just a short version of that. All right, so that needs to be uploaded onto your day 1. If the preceptor does want you to fill out a quick little contact info, there's a form in there for that as well. All right, so let's go on to tab 2. This is a hours record simply for you and your preceptor to keep track of the dates that you attended and how many hours you are far along in this. Remember, you need 144 hours in the ED to successfully complete your Nursing 55. This is the evaluation shift for your EMS ride-alongs. If it's already been done, great. If you haven't, we can finish that off at a later time. All right, moving right along to tab 3. Some clinical skills expectations, what you should be allowed to do, whether or not it's under observation or not, is completely up to the hospital, but these are a list of the skills that you have been at least exposed to during class and can further develop during your clinical time. National Red Drug List. This may or may not be complete depending on what system you're in, but these are drugs that hopefully you have been exposed to during your classroom time and you should be very familiar with. Expect your preceptors to ask you questions about those. All right, moving on to tab 4. No, tab 3. No, tab 4. Very important forms here. Clinical evaluation forms. These are your daily evaluation forms. These need to be done, as they say, on a daily basis. Please don't wait till the last minute of your shift to get this done. That'll just make your nurse mad. At some point during the shift, whether it's maybe an hour or so left and you have some downtime, approach your preceptor and ask them to fill this out. Please do so. Expect low grades on your initial shifts. That's just the way the evaluations work. What I would like to see, though, is that if you do get a 2 in any category, please shoot me a quick email, explain what happened. The idea is not to get you in trouble. The idea is to see if we can show some improvement, if there's ways we can help you out, if I need to talk to your preceptor, if myself or your mentor needs to come in to the ED and help you out with some of these skills. We have that means there. These are not ways to get you in trouble. I want to know what's going on before it becomes an issue so we can help you, okay? If at the end of your internship you're getting all 2s and you're not going to pass it and I don't know anything about it, I can't do anything to help you. So once this is filled out, you're going to take this home, you're going to get it in a PDF format, and you're going to upload it to each corresponding shift on your FISDAP account. Your final evaluation, as it says, this is done on your last day. You don't need a daily on your last day, just fill this out on your last day. Make sure the preceptor fills it out thoroughly, and then add some comments in there. Dr. Mackey loves to see comments on the final evaluation, so he knows your preceptor's been engaged. Preceptor is going to sign it and date it. You're going to take this, you're going to upload it to your FISDAP account as well on your last day, but you're also going to send it directly to me as well. All right, on tab 5. This is your clinical assignment worksheet. Again, another very important piece of paperwork. You need to do one of these per FISDAP shift, not one per patient, but one per shift. So you can either pick one of the 6 patients that you um, document on your FISDAP shift, or you can pick a 7th totally different patient. The idea of this form is to get you ready to do PCRs in the field. It doesn't look the same as a PCR, but the information is about the same. Age, sex of the patient, their main chief complaint, any kind of history of their chief complaint. So the OPQRST of it. Get me a sample written in there as appropriate. Any kind of pertinent physical findings right in there. A couple different vital signs. EKG interpretation if it is a pertinent cardiac case, and then attach that strip separately on there. Any kind of pertinent lab values. So if it's a diabetic, if it's a liver patient, if it's a sepsis patient, if it's an infection of any kind, you're going to document those in there. Field treatment, if there was anything done prior to arrival in the ER, this is where you listen in on that paramedic's turnover report to the RN, and they're going to be telling the nurse everything they did. So if it's a cardiac case, aspirin, nitro, fluids, 12 lead, whatever that is. If the patient walks into the ER, obviously you're not going to be able to fill that field in there. But treatment done in the ER, whatever the treatment is, just list it out one by one. You can do bullet format, whatever you feel is easy enough for you to document it. So everything that was done for that patient in the ER. And then last but not least, an admission, outcome, or follow-up. Were they admitted and to what floor? Were they discharged with orders to see their doctor, orders to do this, or whatever it is, and some kind of follow-up for that patient, all right? Doing one of those per FISDAP shift. You're not going to upload these onto your FISDAP account. You're going to hang on to these as documented in your cheat sheet, and you're going to turn them into me at the end of your clinical time. Put them all together like that. All right, and then lab reference sheet. This is just something we've included in there that gives normal values for most of the lab values you're going to find out there in your time. All right, last but not least, your tab 6. Hopefully you won't have to use any of this, but today's time, you never know. In case you do run into some kind of an exposure, no matter what it is, if there was a patient in the ER that had tested positive for TB or had tested positive for the flu, whatever it is, if you didn't have immediate contact, direct contact with that patient, I'm not expecting you to let me know about that. But if it was a patient you were treating, and you had full PPE on, which you always do, just write up a little format because the hospital is going to want to do the same thing. Let me know about it. Call me, email me, whatever it is. If it's in your field time, you're going to be getting a hold of Rick. If you can't reach either Rick or myself, get a hold of Jason Hemler. Let him know. But if it was an exposure, say the patient got blood on you or another body fluid, or they coughed directly in your mouth and for whatever reason your mask had fallen off, and you had some kind of direct exposure, the hospital is going to take care of you at that point. You're just going to be using your health insurance to cover that. But the school still needs to know about that kind of form or that kind of exposure. So fill that out, please do. This is what you use the exposure report form to. And pretty easy to fill in. You're just going to document all of your information here, the patient source if you can get it, what was done for their response wise, what kind of level of exposure it was. Let me know about it immediately and then send it on over to us. You're going to send it to myself and Jason Hemler, and then we're going to forward it up the chain for proper. All right, so that's a that is a tutorial on what to find and where to find it in your binder. Thanks a lot, you guys, and good luck.